We are entering what promises to be a very difficult holiday season. The COVID-19 pandemic is getting much, much worse. The rates of infection are up, as are cases and deaths. Hospitals are overwhelmed and begging people to stay apart, wash their hands, and wear a mask. We're gauging the government's reaction to the crisis, and we're expecting changes to the public health order as we sit here and tape this on Thursday. You're seeing this on Friday night, so if it happened, you know why. To the public health, as we as a state, have we just stopped listening to the governor and the experts here? This is my number one question. It's a very difficult one. Sophie, let me start with you on that. We're getting some other voices in the mix now. We're hearing from hospital CEOs, but the numbers, I mean, you're talking about over the weekend, an extraordinary amount of cases just in a couple of days. What is no one being heard anymore? What's going on here?
I can speak to my own experience, and I will say that I have caught myself at times having sort of categorized activities into that's a dangerous activity and that's not a dangerous activity. So I'm very careful, for instance, when it comes to grocery stores. I'm not going to hair salons, things like that. But I catch myself and sometimes the other people around me thinking, oh, do we need a mask? Yes, we need a mask, right? We're going to be within 6 feet. Oh, do I need to, with you, this person who I trust, do I need to follow all of the rules? And what we're hearing is that a lot of the spread seems to be happening in family groups, in social settings where people do trust each other. Yep. And so then think, okay, well, I don't have to do all of those things. And I think that, so I think in some ways it's like our idea of what we can and cannot do has solidified a little bit into not quite the safest set of activities.
Right. Ed, again, it's a difficulty for the governor. She, as Sophie mentioned, she has tamped on gatherings, but New Mexico is about family. You know what I mean? This is what we do. We gather in family units. How can we possibly ask folks as families to not gather for the holidays? Is that actually a reasonable ask?
Eugene, that's going to be very difficult because you're right. We are a family-oriented community, a family-oriented state, and the big holidays coming up, Thanksgiving and Christmas, this is where families who tended not to even seen each other for 6 months, 9 months, this is now their opportunity. So it's going to be a difficult decision for many people to make, but ultimately you have to ask yourself, and each family member has to ask themselves, is this worth it? Especially if you have family members who are in some of the high risk categories, the elderly or underlying conditions. And it's difficult. Often most people don't accept the seriousness of the problem unless it's staring them right in the face. Right. And we've seen so many stories of people coming out afterward who either had COVID and had a difficult time going through it or lost family members. And that's going to be the point that's going to be so important to get across to individuals, that this may be the 1 year that you make those sacrifices in the interest of family. And there may be no greater thing you can do for your family other than make a sacrifice. But it is going to be a difficult decision for many people to make.
If I can jump in and add to Ed's list of what's coming up in the next couple of months, it's not just Thanksgiving and Christmas. We also have a large number of feast days that actually have started, right? And that is a very significant period, for our tribal communities. The feast day is in many ways about coming together as a family, as an extended family. And so that is also a real concern.
And we see what the numbers are doing on the Navajo Nation as well. So to make that point, Lieutenant Governor, Santa Fe and Rio Rancho have abandoned their return to school efforts, even on a hybrid basis. It's interesting. But something caught my eye in the Journal. That one line from Sue Cleveland in Rio Rancho stuck out. She said many students were planning to travel during the holidays, and people are talking. They're going. They're making plans. I'm hearing from friends saying, "Oh, I'm buying these super cheap airline tickets. It's so easy to travel right now." And is there any one person that can say, don't do this, that everyone will listen to?
Well, let me just say, I think one of the good things about the election coming to a conclusion is some of the nationally known health experts are starting to be more instructive about ways to, if you are going to have a family gathering, if you are going somewhere, how to do it as safely as possible, understanding that some people will make those decisions. I couldn't agree more with what Sophie said. Is we all make a risk assessment about what's safe for us or who we trust. And I think we've all found ourselves in that situation where we say, oh, well, they're my friend and I know they haven't been doing anything. And so you can take off your mask. But we need to set those norms aside and say, every time you're talking to somebody, you need to socially distance. You need to be wearing your mask. You don't need to be hugging. And it's hard because we are a very friendly, family-friendly state. We have these children in schools that need places to go, and teachers are becoming infected, and we have all kinds of things. I think the governor has been extremely resolute in trying to be instructive about what we need to do. And I think with the change and with the national election coming to conclusion, and more encouragement from national experts and the president-elect and other people, it'll be much easier for everybody to adopt a collective approach.
Interesting point there.
Very quickly.
Go ahead, Ed.
Can we just, hang on? There's the vaccine that's been announced. This may be temporary. This may be the one holiday that maybe we need to make some of those sacrifices, because this vaccine that's been announced is a game changer. And so can we just hang on as a community might be the message that to put out there.
I'm glad you brought up Pfizer. I got to bring in Senator into this. Sorry, Sophie, my fault there. Obviously the news exploded. 90% is like an amazing number to hear about. And I got to wonder if somehow the announcement of this vaccine, even though we don't know anything about its availability at this point, might have incentivized a lot of people to go, oh, well, heck, there's a vaccine on the way. I guess we can kind of relax a little bit. Do you get that sense at all, or are you hearing something else out there when it comes to the vaccine?
I truthfully haven't talked to many people about it other than the political side of it, which I'm not going to go into today. But one of the things I have done a little in-depth reading about it, and a couple of the things that are still questions that they don't know about. I mean, I think it's marvelous that we have it. It's a step forward for everybody and in the world, not just the United States. But a question that struck me is they don't know how long the inoculation period will last. Flu shots you have to get every year.
Right.
And the second major question that struck me is they don't have any data on will it work as well for both young people and the elderly, right, or just for one group or the other. So I think that, yes, people are going in their own minds because we're so tired. We're just so tired, right, that we want something to be good. And so I think that there will be, oh, well, it'll be all right. We'll just have 10 people for Thanksgiving dinner instead of 5. And I think that is happening. But I just want to say one quick thing. I'm one of a very small minority of people in our state. I have to go out of state for health treatments twice a year. And I have to go to Texas, which is one of our worst states. But I have no choice about going. And so I'm very, and I will congratulate the airlines. They have done a marvelous job, at least the ones I've been on, at separating you, at doing everything, cleaning, doing those kinds of things. So I applaud them for that, but I'm still in that I'm frightened when I go, even though I have confidence, because I have a 94-year-old mother that lives with me, so is very vulnerable to. So coming back, my and the governor made it where we didn't have to quarantine in the second round that she said for coming back. But I was careful about where I went and what I did. But bringing it back to someone in my home is also very frightening. But there are some of us out there that have to travel. We don't have a choice.
That's right.
So a vaccine sounds like pure heaven to us.
Yeah,
so
I appreciate that. That is a point. Some folks do have to travel. You're quite right. And a reminder again, we're taping this on Thursday midday, so if this sounds just a little bit off the beat compared to what you heard from the governor earlier this morning, meaning Friday morning, about the next steps, we apologize for that, but that's what happens in television. Now, we're back for one more segment in a few minutes, talking Albuquerque police.